Hello and welcome, dear learners, to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 4, Clinical Governance, Leadership and Risk Management in Healthcare, in the Chapter 38, that is Healthcare Leadership, Engagement and Empowerment Part 1, we will be discussing more on the healthcare leadership part, how it influences the engagement and empowerment of the employees, and what are the concept of leadership over there with different leadership styles. So, if you do understand, the human progress over centuries have been driven not only by the group in numbers but by the advances in intellect, aspiration, innovation, and technology, with leadership playing a central role. So, it has been seen that leadership has been identified as a very important factor in shaping all this progress. Leaders are remembered for driving progress through qualities such as emotional intelligence, honesty, clear vision, effective communication, innovation, and the ability to influence people. True leadership is reflected in consistently delivering excellence and aligning team towards a single vision or a business objective with sincerity. Employee engagement and empowerment are a critical leadership tools that motivate teams and inspire them to give the best in achieving the organization goals. So it is a leader that gives an engagement and empowerment to the employees. In today's healthcare environment and in hospital world, we might find that traditional quality strategies alone are insufficient. It doesn't work because leadership is essential for creating and sustaining the strong culture of quality. Without leadership, quality cannot exist. So, in healthcare, strong leadership results in fewer errors and delivery of the healthcare quality patient services. So, the high quality patient services or high quality patient care can only be achieved when the entire team is led in the right direction and towards a common goal. A common goal which is set by the leader with a passion and commitment with every single time, which leads to you for the quality initiatives. So, over 90% of the CEOs plan to increase investment in leadership development programs recognizes that developing human capital is the most critical challenge organizations are facing today, and it has been seen that most of these organizations identify employees with leadership potential. They prepare them for the future role. They can be seen as a successor through structured and customized leadership development program. And leadership development program is paving more importance to be seen in the healthcare institutions today. Global organizations like Amazon, General Electric, Tata Power, and Aditya Birla Group invest in grooming the young graduates for future leadership positions. Now, in the healthcare ecosystem, what is there need to understand for the leadership role? Healthcare ecosystem from silos to the system, and the emphasis on the silos will be there in the healthcare system for today's discussion for this section. So you have seen that many years every department in healthcare organizations or hospitals was treated as an independent entity. Like a department is working in silos with the other department. Or sometimes a one up department was progressing a lot compared to one of the other department. Each department has its own parameters and rating scale for assessing quality was a picture which was being seen previously. What does it resulted to? This resulted in a different performance measures and varied interpretation for a good performance versus to a bad performance across different departments. Due to this lack of standardization across the department, an organizational quality assessment became a very fragmented and inconsistent job which is being seen in the organization. So, due to the lack of standardized protocols and system for measuring, reporting, and improving quality, the success of the healthcare organization depends on the performance of every individual unit across the clinical and supportive services, rather not being taken as one particular department in the clinical or one particular department in the non-clinical. The improvement needs to be taken across the institution. So, healthcare organizations should no longer be viewed as an isolated departmental silos, but being seen as interdepartment parts of a single system. So it should be projected as a single system rather not a small units of those. A healthcare organization functions like our human body, where there are multiple parts, there are multiple organs. But when it comes actually to the thinking part or to operating part, where no part can operate independently. It is not that a liver can operate separately or a heart can operate separately or your brain can operate separately. But the brain is being seen as controlling. So brain cannot even function without the heart, but the brain controlling every of the organs in the body. So the organization must be seen through the system theory lens. It must be seen as an integrated system that connects the processes, that connects the people and the resources working together in tandem, where the leadership will play a very critical role in aligning all stakeholders to this system based approach. So it is more about emphasizing the system theory, which gives the system based approach and working towards a common goal which is set by the leadership. But a goal needs to be with precision and the delivery towards the healthcare quality as an unified system rather not being seen as a separate one. The concept of leadership, we need to understand what does leadership really comes as. So leadership in a healthcare institution where I have to operationalize is that the process of influencing the activities of an organized group towards the goal setted and goal achievement towards the quality. Earlier, what used to happen, management was considered the key factor in improving organizational functioning and the overall performance that used to happen in the organization. But now the thing is that organization require both leadership and management. It is not that only management can work. Leadership along with management needs to work and function effectively. So leadership sets direction for change. It is very responsible for creating organization culture. The cultural base of an organization comes with the leadership and the management working together. Leaders should adopt a transformative rather than a transactional approach, which is very important because transformation is one which is required versus to transaction, which is very inevitable actually to understand for most of the time to the employees or even to organization how to carry towards this approach. Leadership focuses on a long-term goals and the creation of a new vision for the organization where the organization can work long. The managers who are working in the institutions generally aim to operate and maintain the existing system which is there. But an effective leader must also possess the essential qualities of this manager, which is more towards the sustainability part. So, who should be identified as a leader? A leader is a person who has a clear goal, a vision, a mission, or an objective for the organization, which is one to be seen as a leader who either knows how to achieve the goal or someone who knows how to find a way to achieve it. So there are emphasis on achieving the goal versus even finding a way to achieve that goal. A leader has the skill to clearly communicate the vision and goal to the entire team, where many times it is being seen that communication failure leads to leading the group becomes very inefficient for a leader. A leader motivates, inspires, and guides the team towards a set objective. The objective might be set through the management perspectives, but a leader takes an initiative to work on that. A leader uses a positive or a negative reinforcement. Many times it can be seen that there are the strategies which works to a leader are one to keep the teams thriving towards the end of the goal. So they may have to use positive or negative reinforcement of this. What are the characteristics of a leadership? So a person who comes up with these traits or who is being identified for this trait needs to set the characteristics. What are those characteristics to be seen over here as? Every leader has a unique style of functioning, which is being providing the direction and motivating the employee. So providing direction, motivating the employees, and also creating a culture and implementing the growth plans. Because without having a growth plan, working on the first three would not suffice the requirement of the leadership to be identified as a unique style. So McKinsey's Organization Health Index identified that 4 out of 20 leadership characteristics contributes up to 89% of leadership effectiveness. So it can be understood that it is very important that your characteristics of a leadership plays a very important role. What are the supporting other characteristics? For an effective leader, a leader must be empathetic, emotionally very sensitive, and genuinely interested in employees' well-being, who need to be one who is caring to the employee. They needs to have a compassion, they needs to have a bonding actually he or she creates towards the team. There should be an addition of high emotional intelligence, that is called as EQ, which differentiates a good leader from a great leader. There might be incidences that people are being stated with a great leader, but one who is a good leader is one who has a very high emotional intelligence. Seeking different perspectives. Now we can say that leaders create an environment where employees are encouraged to share their ideas to improve the performance, rather not the ideas directly coming only from the leaders, or who is not listening even to the other groups or his colleagues. There is one more importance of what is called as outcome oriented. A leader emphasizes on efficiency, productivity and performance at work, which gives him the trait of outcome oriented. What are few some important leadership styles that we can discuss here is more towards the helpfulness for the healthcare organization. So Daniel Goleman describes 6 leadership styles demonstrated by leaders, highlighting the emotional intelligence as a core component, which is very important to be seen in healthcare organization working very effectively. First one is commanding leader. A leader who demands immediate compliance and follows that do what I tell you approach, exemplified by military leaders such as Sun Tzu or Napoleon Bonaparte or Sam McKenzie. So best suited for crisis as warlike situation, where it is one who can be seen as someone who is commanding, can be leading in a very right and very effective direction. The second style would be a visionary leader who needs to see what is there coming ahead. A visionary leader mobilizes people towards a shared goal using come with me or join me. This is an approach which gives the entire team a vision what a leader usually tries to see. The visionary leader demonstrates self-confidence. He is empathetic and acts as a change catalyst. A visionary leader works best during change or when a clear direction is needed where the organization sometimes is failing to. You may find visionary leader examples including Mahatma Gandhi, Nelson Mandela, or even Mother Teresa. Now comes the third style as a democratic leader, which is being seen as a very popular style. Democratic leader builds consensus through participation using what do you think or what are your views? How do you see this? So, what do you think is an approach which is being settled by a democratic leader? Encourage collaboration and teamwork to achieve common goals. Many times this is a very popular leadership style. You may have Seiki Toyota or Toyota Production System exemplifies this leadership style, and which has been seen as a very popular and very famous leadership style which emphasizes on quality through equal participation. In quality leaders, you need to come up with this style as a trait. Then comes the pace setting leaders. Who are the pace setting leaders? Pace setting leaders are one who sets high performance standards and follow as do as I do now approach. So that do as I do now approach is one which is a pace setting trait actually, which are best suited for situation requiring quick results. Sometimes when you find that there are very unprecedented situations which comes into the healthcare institutions, this pace setting leadership plays a very important role. And then comes the coaching leader. So coaching leaders are one which are focusing on developing people for future, using like try this or come up with this or take ahead this. So these are the words which coaching leaders come up actually with their ideas actually towards the team or to the employees. They demonstrate empathy, they come up with self-awareness, and they also help employees develop the long-term strength, which is sometimes very much important for those organizations who have gone through a very bad phase. You can find the example of Ratan Tata, which is an example of a coaching leader who have taken tremendous efforts to say that there is an empathy which works to his style. The self-awareness which made a very great example to be seen of this leader. Jim Collins' 5 levels of leadership. This is very interesting to understand that what Jim Collins has put up to the leadership to understand in more depth. Level 1, he tries to say that highly capable individual, one who can contribute to the talent, one who can contribute to the skills, and one who can contribute to the productive effort can be seen as a level 1 and very highly capable individual. Then comes the level 2, as stated by him, is like contributing team member who works effectively and contributes to the team goals. Level 3 come up with competent manager, which is one who is achieving the goal through effective planning and organization, where there is a belief to be stated that when you are achieving the goals, you need to have a planning priorly done with, along with organizing skills. Level 4 is one towards effective execution, which is providing a clear and compelling vision, also which drives toward high performance. So you can say performance comes with a compelling vision in collaboration. Level 5 leader. What are the level 5 leaders? Places organizational success above the personal ambition. I want to grow, or I need to work on this, is one which is never being uttered, rather than putting the personal ambition aside, working on the organization and building the lasting greatness which is to be seen as a great contribution to the organization. So in this summary to the first discussion on leadership in this particular chapter, I try to summarize to state that leadership is the ability to influence. It is the ability to motivate and guide individuals and a team towards achieving a shared goals, vision, and organizational objectives. The leader needs to be a great influencer. A leader needs to be a great motivator and someone who is a team and come up with a long-term vision. Effective leaders see a combination of all this action, balancing transformational leadership with essential management skill. Leadership effectiveness is strongly driven by the emotional intelligence, which is very, very important that you have been studied through the Toyota model, which is supported by empathy and the support for others, who is very much open to the diverse perspective and outcome orientation. We have studied with the different leadership style from commanding to vision, affiliative, democratic, pace setters, and even a coach. In the healthcare, we understand the importance of leadership, where strong leadership enables teamwork, come up with a team and a system-wide integration, which gives more quality improvement and come up with patient safety, which will give a lasting organizational impact, where you can say that yes, leadership and management gives more clinical governance part. So with this, we come an end to this chapter, and these references can be seen helpful to you to understand how decoding to the leadership or even the healthcare quality book stated over here can give you more emphasis on understanding the leadership in healthcare organization. So with this, thank you. Thank you for the patience listening.